Hello everyone. Today our topic will be about Waldenstrom macroglobulinemia. It's actually a rare disease occurring about 4 in each 1 million person. That 4 people, likely not all of them will have symptom, but one of that 4 people will have symptom that start from non-specific, including nausea, fever, and fatigue, as we show in this symbol drawing, and with weight loss, anorexia, and then it will that symptom, one day they will have what is called acute state. That acute state, as we show here, they actually will have what's called acute hyperviscosity syndrome. That starts with nose and mouth bleeding, and actually with blurred vision. They could have also a headache, and also they could have even worse than that associated with heart failure, hepatomegaly, and splenomegaly. So why all of that happening to them? Let's start with this bone. This is actually inside the bone marrow. We have what's called a hematobiosis. Hematobiosis, this will give us two lineage, lymphoid lineage and myeloid lineage. Lymphoid lineage will have a pathway of differentiation starting from lymphoblast until reach what is called T cell and B cell. This is lymphoblast, and then T cell give us and B cell. B cell will actually go into, this is a normal condition, will go into the blood vessel. B cell mainly have here an IgM antibody, only IgM antibody. But when they go to bloodstream, B cell will turn into what is called plasma cell, that we all know. Plasma cell will have 3 antibodies, which is IgA, IgG, and IgM. In patients with Waldenstrom, they will have what is called somatic hypermutation in MYD88 that will result in arrested this pathway. When this pathway arrested from lymphoid until reach plasma cell, the disease called on its lymphoplasmacytic lymphoma, because the cell that's forming are not fully mature and they are not undergoing the normal apoptosis. They will stay inside the bone marrow because they are not fully mature to reach the bloodstream as a B cell that will turn to plasma cell, but will stay inside the bone marrow and they will take place of other red blood cell and other white blood cell. Patient will present with anemia, a consistent anemia. They will have a consistent fatigue, and they will have always headache, always fever. So, does all of these patients will have? As we said, only 1 of 4. Okay, 90% of Waldenstrom, or actually all of them, they have that mutation in MYD88. To diagnose them, we actually have a clinical presentation that come up during examination. They may find a splenomegaly, a hepatomegaly. During the history, that patient always have a fatigue, a fever. Also, they could have sometimes blurred vision, as we said. And to explain that more, when these B cell, as we said earlier, we said it have IgM antibody, and when it go to blood vessel, they will turn into plasma cell, which basically have 3 antibody. This, when arrested and not fully mature, they will stay as only IgM antibody. So these molecular as high molecular weight that will result in blood viscosity. That viscosity will be inside our bloodstream, and it will result in heart failure, will result actually in nosebleed, will result in maybe splenomegaly, and we say hepatomegaly. The confirmation of this diagnosis will need a bone marrow biopsy that will result in lymphoplasmacytic infiltration, and also we need a monoclonal serum IgM. Okay, for treatment, for symptomless patient, no need for any treatment. While in patient having all of these symptoms, we need what is called a combination therapy that is include a rituximab and chemotherapy. Rituximab, what will do, is basically it will attach to the B cell, and when it will attach to the B cell, the natural killer cell that occurring during this pathway of hematobiosis will able to recognize these B cell that is not normal, that is actually abnormal cell, and able to degenerate. And also the drug itself, rituximab, will directly lead to this cell death. Okay. In cases of acute hyperphagocytic syndrome, which is that occur in this patient, actually we need what is called plasmapheresis, that is basically filter all of these IgM from the blood. Okay, that will be the end of our topic, and thank you.